to Smarter in September. I'm Kelly Robert. I'm the Journey Program Manager here at Union Bank. And Journey is an enrichment and education program for our customers and their friends who are 50 and better. Actually, you can be any age at all to participate in Journey. We think the more the merrier. And we offer our education and enrichment and entertainment in many different formats. And educational series that we started doing during the pandemic is Smarter in September. And the premise behind it is very simple. We just give you a chance to learn more about timely topics. We're at the very end of yet another Smarter in September series. We're coming in on the end of 2025. And some might say we've saved the very best for last. This week's segment is unfortunately all too timely for all too many people. It's Smarter About Dementia, Insights for a More Supported Journey. And we are so privileged. All of the presenters for this segment this series, have been incredible. Today, we have Gayleen Bradley, a certified dementia consultant who's dedicated her time and expertise at helping others navigate their journey. And while we've been sitting, waiting to join you folks, Gayleen and I have been talking. My goodness, I don't know when she has time to do anything besides serve others and help them. She's the director of Orchard Park Assisted Living.
Mm-hmm. Yeah.
And she also leads more than one dementia support group and is involved in so many things that revolve around either folks living the dementia journey or those walking with them on that journey. She can explain it much, much better than I. I'm going to let her take the stage. Please help me in welcoming Gayleen Bradley. Gayleen, thanks for joining us today.
Well, thank you very much for having me, Kelly.
Let's get your presentation up here.
All right. So we're going to talk about this dementia journey, which is different for everybody. And if you do have any questions, please put them in the chat, and I would be more than happy to answer them. So I always try to start out with trying to explain in very simple terms what dementia actually is. And normally when I ask that question in public, the first answer I get that people connect with dementia is memory loss. And there's a lot of other things that go on this dementia journey than just memory loss. There's a lot of different things that happen in someone's brain, and the brain cells are actually starting to die. Different areas of the brain get affected, and different things start happening. So one of the things that happens is they lose the ability to focus and pay attention. So that becomes really difficult for them to sit in front of a TV for a really long period of time. They don't remember what they're watching, and they tend to, get up and start wandering around because of that. You also have visual perception, which is something that most people do not realize, that their vision actually gets affected when you have dementia, and you start losing your peripheral vision. It becomes smaller and smaller. And a lot of family members start noticing that something is wrong because, their loved one is coming home and the sides of the cars getting scraped up, the mirrors might be getting hit, and they're like, what's going on? What'd you do, Mom? And their mom's go, I didn't do anything. What are you talking about? Somebody must have hit me type thing. Well, like I said, that starts happening because their visual or their peripheral vision gets smaller and smaller. So that's something that you want to pay attention to. They actually, a lot of times, will want to keep going to the eye doctor because they feel like their glasses are not right and they want to keep getting them switched up because they can't see very well. And it isn't because the eye doctor is not doing their job correctly. It's because of what's actually going on inside their brain. So this one also is a really big one. Their reasoning and judgment become affected. Your reasoning and judgment is behind your frontal lobe in the front of your brain, and it becomes very difficult for them to understand what's being said to them or understand how to problem solve anymore. And so they start making really bad decisions. They might be going outside when it's 100 degrees outside, which I've personally seen people do, with a coat on, coat and hat, and it's really hot outside. It's not because they just felt like doing something silly that day. They're just not recognizing, they don't have any reasoning skills to realize that it's really hot outside. So like I said, that's something you really want to pay attention to, especially with family members not understanding that your reasoning and judgment are being affected. This is a time that family members can get very frustrated with the person on this journey because they do not understand why they cannot understand they shouldn't be wearing the coat anymore. They tend to sit there and argue with them a lot. So, like I said, this reasoning and judgment becomes very pronounced, and it can be very frustrating for them and for you. Your communication and language skills become affected, so they start losing the ability to understand what is being communicated to them. They say by the time they're in the mid stages of the disease, they're only understanding about 2 or 3 words out of the sentence that you're saying to them. So you need to keep that in mind because we tend to ramble on a lot. We give them a lot of directions, and then you come back and check on them, 10 minutes later, and they're sitting in the bedroom and they might have done the last thing that you told them to do, but they didn't do anything else. And that's because not only do they forget it, but they did not pick up on everything that you said to them. And they also will lose the ability to speak correctly. They get what's called aphasia. And so it becomes they can call it word salad. They just have a hard time picking the right words to say. And in conversations with them become very difficult. And once again, you can get frustrated, they can get frustrated, and it can cause a lot of issues when that happens. And then, of course, your memory is going to be affected. And with dementia, to get a true diagnosis of dementia, when you see a specialist, they are going to find at least 2 of these issues that are going on inside your brain to give you a diagnosis of dementia. So you're going to have at least 2 of these issues going on. And they will also have a difficult time carrying out daily tasks. So things that they've done their whole life, getting up every morning and going and taking a shower becomes really hard for them to do. Changing their clothes, they forget about that and they think that they have done it when they haven't. So that's another thing that will happen, which can be, once again, frustrating for families, not understanding why they're not remembering to do that. So like I said, these are the things that are going on inside their brain that are not working correctly, that a doctor will tell them that they do have dementia. So a lot of people, when they talk about dementia, I have heard them say to me many, many, many times, well, I'm not sure if my dad has dementia or if he has Alzheimer's. Dementia is the big umbrella word that, just like this says, it describes a collection of brain diseases and their symptoms, which all consist of the things that we just talked about. But there's different types of dementia, and there's actually a little over 100 different types of dementia. And Alzheimer's is the #1 type, as you can see on the screen. There's a lot of people that are diagnosed with Alzheimer's. but there's the most 5 leading causes are right here: vascular dementia, frontal temporal lobe, Lewy body, and then there's actually mixed dementia, which means that you can have more than one type at the same time. My dad actually was on this journey for almost 15 years, which is a very long time for someone to be on this journey. 10 of those years he lived with my sister. And that was a hot mess, just to say. It was a hot mess. And he was diagnosed with Alzheimer's, with vascular dementia, and with Lewy body dementia. And Lewy body is a little different than the rest of them. A lot of times people with Lewy body will have Parkinson's. There's actually a 50% chance that if you have Lewy body, within a couple of years, you'll be diagnosed with Parkinson's, or the other way around. Lewy body dementia a lot of times has a lot of visual and auditory hallucinations, but especially visual hallucinations. But I just tell people that it's really important that if you know, whether it's yourself or a loved one, you feel like something's going on, I really encourage you to go get a proper diagnosis from the professional, which is a neurologist. Here in Lincoln, that's a little harder to do. There's not as many neurologists as there are in other places. Of course, Omaha has a lot more. The hospital, the university hospital, does a great job on having some really good neurologists there. So you might want to consider doing that. But like I said, if we have issues, you know, with cancer, or we have issues with our heart, we go to specialists. A lot of times, for some reason, people that have issues with their brain tend to just go see their medical doctor, which I'm not bashing medical doctors by any stretch of the imagination, but I would at least get an official diagnosis from a professional and then take their advice and go from there. So the most common types are the most common causes of dementia. I get asked that question a lot too. So what causes it? Age. We're living a lot longer than we used to. There's a lot of times people are starting to get that diagnosis from the age 65 and on. Like I said, we are living a whole lot longer. One of the reasons they believe that at the age of 65, they're seeing so many people show up with cognitive issues is because what do we do in this country? You know, at the age of 65, we tend to retire. And when we retire, a lot of people tend to sit in front of a TV. They lose their sense of purpose. They get bored, and their brain is not being engaged like it used to. So just that alone are things that you might want to think about. You know, when you're retiring, don't retire your brain. You know, you might want to retire from your job, but don't retire your brain. There's lots of things you can still be doing. Family history, the genetics, they do tend to run in families, but not always. And interestingly enough, it tends to be that if you do get dementia if your mother had it, you're more apt to get it through your mother's genes than you are through your father's genes. Not exactly sure. I'm not a doctor, so I'm not exactly sure why that is, but that's what they say. But it, like I said, it can play a part in it. They have found over the years, this was something that I actually have been talking about for over 15 years. Lifestyle choices. And it used to be I kind of would get my hand slapped on that because there wasn't a lot of evidence towards that. Now there's a lot of evidence that our lifestyle choices make a big difference in how our brains work. And, you know, the food that we eat, all of the processed food that we eat, especially ultra processed foods, are not good for our brains. They have a lot of chemicals in them. You don't eat real food. You're eating a lot of chemicals, a lot of sugars, a lot of oils, a lot of salt, which is not good for your brain. As I said, we drink a lot of soda. I hate even saying that word because usually when I'm doing this, I'm doing it in front of people who are drinking soda. So I don't want to hurt anybody's feelings or make anybody mad. But once again, soda is nothing but a bunch of chemicals which kill your brain cells. Alcohol There is actually alcohol-induced dementia, and a lot of people do not realize that, but there is. Um, there is someone that I know, he is only 61 years old, and he has alcohol-induced dementia, and he's living in the community. The youngest person I've seen with alcohol-induced dementia, she was in her 40s. So it can show up pretty young, but alcohol, once again, kills your brain. Smoking kills your brain. And if you do both of those things, you're really hurting your brain. The lack of exercise or lack of socialization, um, digital devices. I could talk for the next hour alone about what our digital devices are doing to our brain. They're dumbing us down. I know they call them smartphones, but believe you me, they do not make your brain smart. And they actually now have um, what they are attributing to a lot of people called digital dementia. And they have actually even come up with children that they are saying have digital dementia just because of them being on their devices all the time. And all of that scrolling once a day, once again, really causes your brain cells to die. And then it becomes an addiction on top of that, so you add that addiction to it, is not helping. The college age kids are struggling in a big way with being addicted to their devices, and they also are really struggling because of that with depression and anxiety, which are two things in our country that most people on some level are dealing with. A lot of anxiety and depression, and a lot of it can be pointed right back to our lifestyle choices, and especially with digital or with our digital devices. Fresh air, sunshine, sleep are huge. They're great. Our brains need it. Our bodies need it. We don't get enough of it. We don't engage in that type of lifestyle like we used to, and we really need to. And stress. I tell family members all the time, stress will kill you. It kills you. And the person that is the family caregiver will most of the time be the one who dies before the person that's traveling this journey. And they do not recognize that. And I actually had somebody in one of my support group that came to my support group. She would always tell everybody, "Oh, we're doing fine. Things are great. You know how wonderful everything really is. We're not on the same journey everybody else is." And I ended up getting a phone call from her son asking me questions on what to do to help with the dad because he had to take his mom to the hospital because she had a stroke. She ended up dying. She ended up dying within a week. That is not uncommon at all, and it's the stress we put ourselves under, and we don't even understand we're doing it and that we're under stress. So we are going to talk about that towards the end of this, because if you are a caregiver and you are not taking care of yourself, it becomes very difficult for you to take care of your loved one, your family member. The stress that my sister was dealing with almost killed her, actually. My dad died a year and a half ago, and she's still trying to get herself back from that. Untreated depression is something that can lead a lot of times to dementia. So if you yourself or your loved one, someone is got depression, I would highly encourage you to go get some help with that and make some lifestyle choices yourself, because the lifestyle choices that we're talking about right here that contribute to dementia are the very same things that contribute to depression and anxiety. Head or brain trauma. Once again, our brains have a very hard time if they have had some type of trauma. And it can even be something that happened to you 20 years ago that can show up, in dementia. So you just want to be cognizant of that can happen. So I'm going to beat a dead horse. You want to take good care of yourself, just knowing that those types of things can show up 20 years later. So almost always, you do not just have dementia. You have what's called a comorbidity that goes along with it. And almost always, the comorbidity that you're going to have is cardiovascular disease, high cholesterol, diabetes, and high blood pressure. And every other country but our own, they call Alzheimer's type 3 diabetes. That's how closely related they are. Diabetes and Alzheimer's. But if you think about it, it makes sense because the blood sugar inside your body is not working the way it should. That's why you have diabetes. Well, the breakdown of the sugars in your brain are not working right, and that's why you end up with Alzheimer's. So, once again, if you do have diabetes, I highly suggest you go back to these lifestyle choices and do something. Those are things we can make a choice in. Those are things we have full control to change. It might be difficult. Most people don't like putting down the hamburger and the French fries, they don't. But I would encourage you to try to take one step at a time to do that. But like I said, all of these diseases are almost always shown up with dementia, and those are things that can be taken care of with lifestyle choices. Okay, so this is a dementia clock test, which most of the time they are going to have you take if you are being tested, cognitively, in which I suggest that everybody at one point or another, especially if you feel like you're struggling with your memory, just go take a test. At least you will have a guideline that if you go back 2 years later and you know how you were doing 2 years ago, which can really help. With this drawing, I show this because it can be very impactful when I tell people that at the moderate stages of the disease, the middle picture, you can see this clock that someone drew. And do you know what most people are doing in the mid stages of the disease, what they still continue to be doing? They're still driving. Right, they're still driving. And this is what a clock looks like to them. So that's another reason their peripheral vision, is not working correctly. That's why you come home and the car might be scraped up a lot. The windows or the mirrors are getting bent, and this is why. So like I said, it's really important to get these things checked out. So we're going to talk about, just some of the warning signs, some of the things you might notice is that you will lose the ability to navigate your world. That becomes really difficult for you to do. You're forgetting, what day of the week it is. You're forgetting what time it is, whether it's 7 a.m. or whether it's 7 p.m. You really lose the ability to even keep your checkbook anymore. And I've had family members call me and tell me, I know something must be going on with mom because her checkbook, I'm looking at her checkbook and it's a hot mess, and she used to be a bookkeeper or an accountant or whatever it may be, so that becomes really hard. Too much stimuli is very confusing and overwhelming to people, so they sit in front of a TV. Once again, I have been in a room with someone that did this, where she's got the TV on, she's watching CNN, watching the news. She thinks that this riot that she's watching on the news is actually happening in her living room, and she's picking up the phone calling 911 to get the police there to take care of that. So those types of things really happen a lot more than people even realize. And we talked about the inability to understand what's being communicated. And they also lose the ability to express their needs, so that's why they start acting out in interesting ways, because they cannot do that any longer. So the word that I like to use instead of behaviors, that they're having behaviors, because when you say the word behaviors, it's as if they're intentionally trying to do something wrong, or they're trying to annoy you or make you angry, and they're not. They're expressing an unmet need. That's what they're doing. They're trying to tell you that something's going on and I need help. So they can become anxious and worried. They can become agitated. They can become aggressive. They can become physically and verbally abusive. And they can start wandering around. They can just start pacing around because that becomes very difficult and they don't know how to tell you what's really going on and what they need. Okay, so some health concerns also that can cause reactions that can cause them to act like this, and it is associated with the dementia decline, is dehydration is huge. Most people do not like water. Most people don't drink water. People with memory issues certainly don't drink enough water, and they can become very dehydrated, which can lead to urinary tract infections. Urinary tract infections and dementia go hand in hand. It is very common for someone with dementia to have a urinary tract infection. And I want to make sure people also understand that urinary tract infections that are left untreated can cause people to become, oh, my dementia's showing up. I can't think of the word. No, um, okay, I'll think of it in a second. If somebody thinks of it, put it in the chat. Oh, septic. You can become septic. And when your body gets all of these poisons in it, and it can actually kill you. And it did happen to my dad. He became septic and did almost die because of it. So you want to really make sure that they're drinking enough water, and it's not soda, it's not coffee. Actually, most people do not realize this, but coffee also kills your brain cells, and it's not, the caffeine is not good for somebody with dementia. I know a lot of people who like to drink it though. Malnutrition, they tend, chemicals in the processed foods we've talked about. People with dementia lose their sense of taste and smell. And that usually happens much earlier than they even get a diagnosis of dementia. They will lose their sense of taste and smell. And when they do that, that's another reason they tend to eat a lot of garbage, is because they can't really taste their food anymore. So ice cream tends to be a really big deal to people with dementia. And of course, that's not very good for you at all. But they do tend to become very malnourished. And they can also, forget that they haven't eaten, and they will start losing a lot of weight. So you want to pay attention to that. We've talked about depression and anxiety, infections, like I said, not only with urinary tract infections, but also teeth infections. They can have a tooth infection, not be able to tell you that they're in pain. They're not able to feel that with urinary tract infections. A lot of times they will not feel the pain. They lose that sense to be able to feel it. And of course, your teeth and your brain are very close together, so that can do a lot of damage. Like I said, they can just flat be in pain, have knee pain, whatever, back pain, not be able to tell you. And sight and hearing problems are a really big thing. Also, we've talked about sight, but hearing problems. They believe that people who have hearing problems and do not get it taken care of actually have about a 65%, I believe, a higher chance of ending up with dementia also. And they believe that that's the case is it's because your brain works a lot harder to understand what's being said to you if you don't get your hearing problems taken care of. So that's just another thing you want to think about.
Lots to think.
There is a lot to think about. There is. So part of being a care partner, instead of a caregiver, you want to be a care partner, is you need to look for these unmet needs, because like I said, they are not going to be able to tell you what they are. And if you start seeing them acting out in some way, you want to stop and think about, why are they doing that? You want to ask yourself, when was the last time they had something to eat? When was the last time they drank something, went to the bathroom? Too much noise going on, glasses, hearing aids. Are they tired? Did they sleep well the night before? Are they out of their routine? That can be really big. And another thing about being out of their routine, this can show up 2 to 3 days later that they've been out of their routine, and then they start really acting up. it might take them a little bit, and that really throws families off because they will not understand that. But I've had a lot of families share with me they've taken their loved one on a vacation somewhere and come back, and it just does not go well for a while, and that will be why. A lot of times, like I said, they can just be in pain. So you want to pay attention about medications. Another huge thing that I found with a lot of the residents that I'm around is a lot of people can be too hot or too cold and not be able to tell you. So look for the signs, or they sit there huddled up where they look like they're actually cold. And just, I have found just putting a blanket around somebody can help tremendously. It's very comforting to them. Are they bored? That's the answer a lot of the time, is they're bored. And we tend to want to set them in front of a TV. And how many of us get bored? How many of us get tired of sitting in front of a TV, or our bottoms start hurting? And they might not be able to get up and go walk around like they need to, and they're hurting from sitting there in that chair. So those are things you just want to pay attention to. Sometimes they can have on clothes that are too tight, and feel uncomfortable. And like I said, once again, they're not able to share that with you. So your best friend is to be a detective. Your best friend is to put on your thinking skills and really start problem solving. A lot of times, if we just learn to problem solve some of these things, it can make not only their day better, but it can certainly make your day much, much better if you do that. So some other things that you really want to think about also is stepping into their world. We tend to, especially, I see this a lot with husbands and wives. They've had their roles to play for many, many years. The husband's always paid the bills, taken care of the lawn, done certain duties, and now the wife's having to do it all. And it's not uncommon for the wife to be a little pissed off about that. And you know what? That's okay. Life is not always fair, and you need to give yourself some grace and mercy. We need to show other people grace and mercy, but we also need to show our own selves grace and mercy, because this is not an easy journey. And it is hard for us to all of a sudden be taking on all of these responsibilities that you had a partner in your life for a long time doing. But we do also need to have some empathy for them, because they did not choose this journey, it was given to them. And they are pissed off a lot of times too, that they're having to travel that journey. So you need to keep that in mind. And sometimes we don't stop and think about, what must that feel like? To be losing your memory, to know that you're not going to remember, the things that meant something to you, to know you're not going to remember who your wife, who your husband, who your children all are. So if we just have some empathy with people, one of the short analogies I use sometimes for people just to stop and think about, what if you worked for a company and you were having to go on a trip to Japan all by yourself for a meeting out in Japan. So yeah, you get on this plane, you're out in a new country, you get off the plane, you are sitting there thinking, you know what, I haven't eaten for a long time and I'm really hungry. And you're walking down the street trying to figure out where you can get something to eat. And everything's it's all written in a different language. You don't understand the language. You can't figure out where you need to go. But you smell some food coming from a building. You go in there, it's a restaurant. You go get set down to get something to eat, and they give you the menu, and guess what? It's all written in Japanese. So how would you feel if you were that person? You're tired, you're hungry, you're frustrated, you're annoyed. You're feeling all of these feelings, and that's what happens to somebody on this journey. They're feeling the same thing. So if you just put yourself in their shoes sometimes, it can help you be a little more patient with them. One of the things that we also tend to do is forget. Some of us might not even know. The power of touch is huge. And the power of touch sends endorphins to our brain. Just holding somebody's hand or touching somebody's shoulder and applying some pressure to their shoulder sends endorphins to your brain that go, oh, that feels good. I like that. And it also makes that person go, the person that's touching me must care about me if there's spending the time to do that. So it's really important for us to do that. And sometimes the last thing we want to do with our loved one is give them a big old hug because you're really not very happy with them, you're frustrated with them. But the best thing you could do for both of you is to give each other a hug, because you're going to send a lot of really good feeling endorphins to both of your brains by doing that. And you can really make a situation become bearable just by giving somebody a hug. Love that. Just that. Like I said, if nothing, hold their hand and squeeze their hand. It's by putting pressure. It's putting pressure in the palm of somebody's hand that makes those endorphins go to their brain. Go give them a massage, or go take them to get a massage. Get one yourself. Do a couples massage. But they have found that that helps people hugely. And I have a daughter who does that, as a matter of fact, with massage. And they have just found people with cognitive issues respond to that in a really big way. Neat. So try it. Learning how to respond in a situation instead of react in a situation can make your life so much easier if you learn how to do that. Telling somebody no that has dementia does not work. Most of us do not like being told no, and people with dementia really don't like being told no. So we'll talk about a few other things you can do maybe than telling them no. Arguing with them never works. I ask people, have you ever tried to argue with somebody that's drunk? How'd that work for you? It doesn't. And it's the same thing. When you're trying to argue with somebody who is intoxicated, their brain is very affected. Same thing with somebody with dementia. Their brain is affected. You cannot argue with somebody and get anywhere. So I encourage you not to do it, because it's just going to cause a lot of anxiousness between the both of you, and it doesn't do any good. Making direct eye contact with somebody with dementia is huge. Okay, because it's very hard for them to understand their world anyway. So you want to look them in the eye. And another thing that you do not want to do, and we tend to do it a lot, is stand over that person. Sure. You don't want to stand over them when you're trying to have a conversation with them and you're trying to get information to them that you need them to do. If you sit next to them or you kneel down next to them, look them in the eye. Don't stand over them, because that's a power stance when you do that. Mm-hmm. And you just patiently and as few of the words as possible tell them what you need them to do. You would be surprised how well that will usually go if you do that. Your tone of voice is big too, so you don't want to have a loud voice and you don't want to show any frustration when you're doing that, but it can make all the difference in the world if you do that.
It's working on me.
Very good. So techniques to use in caring for those with dementia. Redirect them. Learn how to redirect. Whether it's the subject, you can tell they're going to start talking about something. With my dad, it would have been money. Any time that he started wanting to talk about his money was a time you wanted to change the subject, because he was one of those people who never trusted anybody. So he always thought people were trying to rip him off. He always thought people were trying to steal his money, and it would go down a bad rabbit hole if we let him go down that subject. So you just change the subject. Dad, look at the pretty flowers outside, and you just want to talk about something different. Change their walking direction. Some people are wanting to head off into a room, that has things in there that maybe they really shouldn't be messing with. So just hold their hand, take it, put your arm around them and take them off in a different direction and just redirect. You don't have to tell them, no, you can't go in that room. No, you don't want to do that. Just engage them in a friendly conversation and go about it in a different way than they were going. This is really huge too, is to know their triggers. Know their triggers that are going to annoy them, but also know the things that they really like and use those things that they really like. If you know that they really like Earl Grey tea, hey Dad, let's go get a cup of Earl Grey tea. Take him by the hand, walk him into the room, and change the subject just by saying that. Talk about something that they like. You also want to stay away from their pet peeves. But knowing these triggers and trying to stay away from them or using them when they're good ones are huge. Another thing that even with our own family members, we tend to just forget to do is talk about their life story. It was important to them for what they did for a living, for what they did even out on a farm. Some people think, well, I didn't have any important job. You don't have to have an important job. Your life story, whatever you did, was important to you. So talk about that story. Bring out pictures, about that story. And I would really encourage you, even as family members, as siblings, to have a book somewhere where you can add all those memories up in the same book. And I don't know if you've had the experience of talking to your siblings about stories you have growing up, but it's like all different. It's like what home were you raised in? Exactly. I don't remember that. What are you talking about? So everybody can have a different story. And so if you just collect those stories and collect pictures that go along with them, and like I said, especially the pictures of your loved one, with whatever they did that was really important to them is really important to use on this journey, and talk about those things to them. I have done that many times with people. I found out important stories, and just to see the smiles on their face, and those memories, they go back to those memories. And that's another thing. Speaking of that, that's another thing that family members get very frustrated in, that I did not touch on, is that they sit there and ask me, why is it that I keep having to repeat myself every 10 minutes? Because they can't remember, what I told them 10 minutes ago, but they'll remember what they did 50 years ago. I don't get that, and it can irritate them. We have two different memory blocks. You have your short-term memory and your hippocampus. When you get dementia, that's what's affected. And so your short-term memories are affected in that hippocampus first, and you lose that. But your long-term memories are stored in a different area of your brain, and those stick around for a long time.
That's why people with dementia know all the words to songs.
Correct. Correct.
And I love that.
And it's very important, and I think I have that in here. You want to play music, and you want to play music that they would have listened to, that they would have known in their teens and in their early 20s. Because yes, music is emotional, and it's the emotions part that are stored in a different part of your brain. That's why they remember these memories. It's in that part of your brain that's emotional. And you can use that to your advantage in a huge way if you remember that.
Great.
So yes, sing songs to, like I said, I have that in here. It's huge. But talk about, like I said, their life story, and come up with a memory book. Simple choices. Nobody likes being told what to do. Nobody. And we tend to do that with people with dementia. We start treating them as if they're a 2-year-old, because sometimes their actions can be as if they're a 2-year-old, but they're not. So you don't want to tell them, do X, Y, and Z. Give them a choice. And I tell people all the time, don't give them a choice. Do you want to take a shower? Because they'll tell you no. But you can say, you know what? Today's shower day. Do you want to wear this pretty pink sweater or that pretty pink sweater? Because pink is their favorite color, right? So you want to give them a choice, what they get to choose, but you're not giving them the choice on whether they're going to take a shower or not. That can help tremendously if you just do that right there with choices. Soft music. That's what we talked about.
Music.
But music, period, that they would have grown up with is great, but soft music really helps a lot. It's very therapeutic. Weighted blankets can be really, really good, even if they're not weighted, just a blanket, period, wrapped around them. Can be very comforting for them. Don't say too many words at one time. None of us really like that, especially people that can't retain all of that. Give them time to process. That's another thing that I've been guilty of myself, is that you can tell them something and then you want to go in and repeat yourself because you think they did get what you said, but it takes their brain longer to work. So give them a couple of minutes to process what you said to them before you go and start repeating yourself to them. That's showing them a little bit of dignity too. Give them a little bit of time by doing that. It is. So give them a reason to laugh. You know, we don't we stop telling jokes. We stop making life humorous. And it's really important that on this journey you find as much humor and laughter as you possibly can, because this journey's hard. You know, it's hard, and we need to recognize that it's hard. So the more time that we can spend having fun and finding humor and even the small things is a really huge thing to do, not only for them, but for you also as the caregiver. So intervene within 30 seconds. If you see them start getting agitated, if you just walk away and ignore it, I promise you it isn't going to go anywhere. It's only going to spin out and get worse. You know, so if you intervene and go take a walk, you know, go just redirect quickly, that a lot of times will stop it from happening. Don't embarrass or reprimand them. Nobody likes that, and they don't either, and they'll come back at you most of the time when you do. Change the environment. I'm telling you, dementia and TV are not friends. You know, so if you have the TV on, I would really encourage you to put it on, you know, old TV shows. Keep away from the news. Stay away from the news. Even if you don't have dementia, it's a good idea to stay away from the news.
Sage advice.
Exactly. Yeah, like I said, go for a walk, go to a different room. So this can become anybody's best friend if they learn how to do this, and you do not have to have dementia for this to work really, really well. Learn how to apologize and take the blame even when you didn't do a dang thing wrong. You know, if you just, you know what, you're right. I'm really sorry, and I'll work harder on that next time. It diffuses the situation when you do that, and it makes it very difficult for people to want to sit there and keep poking at you.
It does, doesn't it?
It does. If you just apologize and take the blame. So I encourage everybody, like I said, even with your spouse who doesn't have dementia, if you just learn how to do that, it can stop a whole lot of arguments that we don't have time to have in the first place, right? Learning how to put the relationship first before the task. We tend to want to go in and you know, you got a list of things you got to get done, and you want to just go in there and start ordering them around to get all of these things done because you have a doctor's appointment at 9 o'clock in the morning. If you take the time, just even 5 minutes, to connect with that person and let that person know how much you love them and how much you care about them before you start your list of tasks to do, once again, I guarantee you, you're going to have a much easier time getting those things done and letting them be a part of that process instead of you acting like a drill sergeant and trying to get the things done. Ask simple, open-ended questions that they can answer. You don't want to ask them things that you know that they can't answer. And if you do anything, take out the verbiage. Don't you remember? Take it out of your vocabulary. That is dehumanizing to people with dementia when you sit there and ask them that question. Do you think they'd keep asking you that question if they remembered?
What a good point.
They wouldn't, right? They don't remember. So you're just making them feel stupid when you do that, which causes them to retaliate when you do that. Giving them clues, visual clues or verbal clues are really big. A lot of times they might not even understand the word chair, and you're trying to get them to sit in a chair, but if you pat the chair, hey, Dad, I need you to sit right here, and then their brain goes, oh, yeah, okay, I get that. So simple things just like that you can do. Don't take things personally. Imagine that you don't take things personally, but don't take things personally. You know what, guys? They are not saying and doing what they're doing to aggravate you. They're really not. They're living in a world and doing the best they can with the tools they have. And it's really important to remember that. That's what this says right here. They're doing the best they can. Back off and give them space and time. If you see they're getting agitated, if you're getting agitated, just back off and just give them a little bit of time.
Again, just everyday life skills. Good
Exactly.
stuff. Would you like to take it? Oh, I'll let you take that. And then we have a couple questions.
Oh, yes, yes. So decide what to do differently. Give yourself a 10-minute break. Go 15, go back 15 minutes later and start over again. So tell me, what's the question?
Love that. Really good stuff. I'm so sorry I interrupted you. Okay, the first one, Lori would like to know if the slideshow will be available to download after the presentation. Oh, good question.
Only if you pay me a lot of money for it. No kidding.
That's Gayleen's retirement fund. So
Yeah.
we'll talk.
Yeah, I don't have a problem with that.
Okay, great.
Yeah, not at all.
Great. I can send it out with the recap, or you can reach out to me individually, Lori. Oh, this is Pat, my friend Pat. I've played music for long-term care facilities for many years. When I started, excuse me, Pat, when I started, it was music of the 30s. I've moved to the 40s, 50s, and am currently working on songs of the 60s. Most often, it's the old hymns of their church that makes the connection.
Yes, huge. As a matter of fact, huge. If they went to church at all, most of the time they've known that since they were small children.
What good insight. Of course, Pat, you would know all those old hymns.
Well, and God bless you for doing what you're doing.
Yes.
If you're doing that, because music is huge, and hymns is.
That's a great tip for the
dynamite.
Yes. Thanks. That's what we have so far.
Okay. All right. So,
caregiver syndrome happens when the responsibilities of caring for someone else, whether it's your kids, your spouse, your parents, the pets, all of it, begins to take a toll on your health, your mood, and your sense of self. I just want to start out by listing some of the most common symptoms of what the medical experts call caregiver syndrome. You're constantly tired, even after you've had a full night's sleep. You have trouble concentrating or staying organized. You're irritable. You're short-tempered because you're fried from taking care of everybody. You feel emotionally numb or detached. You're losing interest in the things you used to enjoy. That one creeps up on you. And next thing you know, you feel like all you do is care for people and you haven't been to your book club in 6 months. You start withdrawing from friends and family or social situations, or you might notice that there's a change in appetite, or you're having trouble sleeping, or the sleep patterns are different, or maybe you're getting sick more often. And you keep going, oh, the allergy season is really bad this year. No, maybe it's caregiver syndrome. Maybe you're so worn down that you don't even realize it. You start to feel like your needs don't matter. And here's a big one. You feel guilty when you take any time for yourself. It's important to acknowledge that this is a particular type of stress. And there are 3 reasons why the stress feels so different than any other type of stress. First of all, it's the loneliness. Like you feel like nobody gets it. You're surrounded by people all the time, and yet you feel alone in this responsibility. 27% of caregivers, that's more than 6 million people in the United States, say they feel lonely. That loneliness is linked to an increase in depression and anxiety and even physical health problems. The second reason why caregiver stress is its own unique kind of stress is because the stress doesn't end. It's chronic. I mean, when you're taking care of an aging parent or little children, there's no finish line. And finally, the reason why this stress is so different than other forms of stress you may experience in your life is it's reshaping your relationships. Because you're not just a daughter or a partner or a parent anymore. You're the nurse. You're the driver. You're the advocate. You're the assistant. You're the one who has to keep it all together. Look, I see this in your emails. I see that you're isolated. I see that you're exhausted. I see that your relationships are strained. And the thing that bothers me is I also see that you're making yourself wrong over it. That's going to end today.
Okay, so that was Mel Robbins, who does podcast, and she couldn't have got that more spot on. Guys, you cannot give what you do not have. So you have got to fill your bucket first so that you have something in your bucket to give to your loved one. You have to. It's really, really important to do. And another thing that care partners tend to forget is that they're a care partner. If you were to ask them, are you a caregiver? They'll, no, I'm not a caregiver, because you're a wife, you're a husband, but you are. and you have got to recognize that you are, and you have got to give yourself permission to take good care of yourself. Or once again, something's going to happen to you before something's going to happen to your loved one. So here are some tips, to take care of yourself. There's a lot of things on there. Hopefully you can take a picture, if nothing else, on your phone. But I would really encourage you to do these things for yourself at least 30 minutes a day, at least 30 minutes a day, at least 30 minutes a day. Hopefully you heard me on that, that you're doing something to take care of yourself. So to end this with, when you have seen one person with dementia, you have seen one person with dementia. This journey, everyone is unique. Their personalities play a big part in this journey. And there's not a mold that fits everyone. So there's a lot of different techniques I gave you, and hopefully you can use them in different ways. And just know that this might have worked for your mom. What you did with your mom might not work for your dad or for your husband. So don't try to pigeonhole people with dementia just because they have memory issues, because that doesn't work, because their personality is a huge part in this journey. So,
Wow. You've given us a ton of good advice, and I think that last piece is especially valuable, Gayleen, because we do tend to do that just naturally, to generalize things, because somehow we think it makes things easier, but on that point it
doesn't.
Probably does
Not at all.
Such good stuff. I'm going to stop sharing. If I disconnect, I'm very sorry. No, I'm kidding. There we go. Well, folks, we sure have covered just a ton of information, and we are so fortunate to have had Gayleen here with us today. And twice, 2 segments in a row. This was such a treat for me to actually have the presenter in the room. I could so get used to this. And I've been kicking people out of meetings so that I can use this room, but I kind of like this too. Let's see. Okay, you must have been so thorough, so comprehensive that we're not seeing any questions. We do have several thank yous.
Wonderful.
If you have any questions for Gayleen, here's your chance. Otherwise, you can always email me a follow-up, and I can make sure that Gayleen gets the question. Gayleen, thank you again
for
joining us today and sharing your information. This, again, I said this at the beginning, this is a topic that unfortunately so many of us are touched by. And I think just your reminder that we're not alone, and that the I'm going to butcher this, their care partner is not alone. I think that information alone will do just an incredible amount to get us to a better place in the journey.
And I would encourage the people on that, if they aren't involved in a support group, to go find one. There's actually going to be a dementia resource fair on Thursday that I have helped put together with the Alzheimer's Association. It's going to be at Aging Partners between 2 and 5. And there's going to be a lot of different resources that are going to be there, just so that you know they're out there in the community. I would really highly encourage you to come if you can. Like I said, once again, it will be this Thursday at Aging Partners between the hours of 2 and 5. So
Victory
hopefully,
Park.
Yes, at Victory Park. Hopefully you will be able to come.
Great. Okay, well, thank you once again. Thanks to all of you for giving up a slice of your Tuesday afternoon. This concludes yet another series of the Smarter in September. And there's another thank you series. It concludes, another segment in our Smarter in September series. We're done for this year. See you in the new year with Tune Up Tuesday. Take care, everyone. Be well.
Bye.